Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. A nurse has identified that the patient has overflow incontinence. What is a major factor that contributes to this clinical manifestation? Option A. Coughing. Option B. Mobility deficits. Option C. Prostate enlargement. Option D. Urinary tract infection. Right answer is option C. Prostate enlargement. An enlarged prostate compresses the urethra and interferes with the outflow of urine, resulting in urinary retention. With urinary retention, the pressure within the bladder builds until the external urethral sphincter temporarily opens to allow a small volume, 25 to 60 milliliters, of urine to escape. Overflow incontinence. Coughing, which raises the intro-abdominal pressure, is related to stress incontinence, not overflow incontinence. Mobility deficits, such as spinal cord injuries, are related to reflex incontinence, not overflow incontinence. A nurse must measure the intake and output, I and O, for a patient who has a urinary retention catheter. Which equipment is most appropriate to use to accurately measure urine output from a urinary retention catheter? Option A. Urinal. Option B. Graduate. Option C. Large syringe. Option D. Urine collection bag. Right answer is option B. Graduate. A graduate is a collection container with volume markings, usually at 25 milliliters increments, that promote accurate measurements of urine volume. Although urinals have volume markings on the side, usually they occur in 100 milliliters increments that do not promote accurate measurements is impractical. A patient's urine is cloudy, is amber, and has an unpleasant odor. What problem may this information indicate that requires the nurse to make a focused assessment? Option A. Urinary retention. Option B. Urinary tract infection. Option C. Ketone bodies in the urine. Option D. High urinary calcium level. Right answer is option B. Urinary tract infection. The urine appears concentrated, amber and cloudy because of the presence of bacteria, white blood cells, and red blood cells. The unpleasant odor is caused by pus in the urine, pyuria. These clinical manifestations do not reflect urinary retention. Urinary retention is evidenced by suprapubic distension and lack of voiding or small, frequent voiding, overflow incontinence. A nurse is caring for a debilitated female patient with nocturia. Which nursing intervention is the priority when planning to meet this patient's needs? Option A. Encouraging the use of bladder training exercises. Option B. Providing assistance with toileting every 4 hours. Option C. Positioning a bedside commode near the bed. Option D. Teaching the avoidance of fluid after 5 p.m. Right answer is option C. Positioning a bedside commode near the bed. The use of a commode requires less energy than using a bedpan and is safer than walking to the bathroom. Sitting on the commode uses gravity to empty the bladder fully and thus prevent urinary stasis. Although option 1 should be done, it is not the priority. Option the second of may be too often or not often enough for the patient. Care should be individualized for the patient. A practitioner uses a urine specimen for culture and sensitivity via a straight catheter for a patient. What should the nurse do when collecting this urine specimen? Option A. Use a sterile specimen container. Option B. Collect urine from the catheter pot. Option C. Inflate the balloon with 10 milliliters of sterile water. Option D. Have the patient void before collecting the specimen. Right answer is option A. Use a sterile specimen container. A culture attempts to identify the microorganisms present in the urine, and a sensitivity study identifies the antibiotics that are effective against the isolated microorganisms. A sterile specimen container is used to prevent contamination of the specimen by microorganisms outside the body, exogenous. A client who has an indwelling catheter reports, "I need to urinate." Which of the following interventions should the nurse perform? Option A. Check to see whether the catheter is patent. Option B. Reassure the client that it is not possible for her to urinate. Option C. Recatheterize the bladder with a larger gauge catheter. Option D. Collect a urine specimen for analysis. Right answer is Option A. Check to see whether the catheter is patent. A clogged or kinked catheter causes the bladder to fill and stimulates the need to urinate. Reassuring the client that it is not possible to urinate is a non-therapeutic response because it diminishes the client's concern. Opt 2. There are less invasive approaches the nurse can take before replacing the catheter. Opt 3. Although it may become necessary to collect a urine specimen, there is a simpler approach the nurse can take to assess and possibly resolve the client's problem. Opt 4. A provider prescribes a 24-hour urine collection for a client. Which of the following actions should the nurse take? Option A. Discard the first voiding. Option B. Keep all voidings in a container at room temperature. Option C. Ask the client to urinate and pour the urine into a specimen container. Option D. Ask the client to urinate into the toilet, stop midstream, and finish urinating into the specimen container. Right answer is Option A. Discard the first voiding. The nurse should discard the first voiding of the 24-hour urine specimen, and note the time. The nurse should collect all voidings after that and keep them in a refrigerated container. For a urinalysis, the nurse should ask the client to urinate and pour the urine into a specimen container. For a culture, the nurse should ask the client to urinate first into the toilet, then stop midstream, and finish urinating in the specimen container. Clients should be taught that repeatedly ignoring the sensation of needing to defecate could result in which of the following? Option A. Constipation. Option B. Diarrhea. Option C. Incontinence. Option D. Hemorrhoids. Right answer is Option A. Constipation. Habitually ignoring the urge to defecate can lead to constipation through loss of the natural urge and the accumulation of feces. Diarrhea will not result if anything. There is increased opportunity for water reabsorption because the stool remains in the colon, leading to firmer stool. Ignoring the urge shows a strong voluntary sphincter, not a weak one that could result in incontinence. Hemorrhoids would only occur if severe drying out of the stool occurs, and thus repeated need to strain to pass stool. Which statement provides evidence that an older adult who is prone to constipation is in need of further teaching? Option A. I need to drink 1.5 to 2 quarts of liquid each day. Option B. I need to take a laxative such as milk of magnesia, or if I don't have a BM every day. Option C. If my bowel pattern changes on its own, I should call you. Option D. Eating my meals at regular times is likely to result in regular bowel movements. Right answer is Option B. I need to take a laxative such as milk of magnesia, or if I don't have a BM every day. The standard of practice in assisting the older adults to maintain normal function of the gastrointestinal tract is regular ingestion of a well-balanced diet, adequate fluid intake, and regular exercise. If the bowel pattern is not regular with these activities, this abnormality should be reported. Stimulant laxatives can be very irritating and are not the preferred treatment for occasional constipation in older adults. In addition, a normal stool pattern for an older adult may not be daily elimination. A client is scheduled for a colonoscopy. The nurse will provide information to the client about which type of enema, Option A. Oil retention. Option B. Return flow. Option C. High large volume. Option D. Low, small volume. Right answer is option D. Low, small volume. Small volume enemas along with other preparations are used to prepare the client for this procedure. An oil retention enema is used to soften hard stool. Return flow enemas help expel flatus because of the risk of loss of fluid and electrolytes. High, large volume enemas are seldom used. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.